Hi, welcome back to the Dr. AKINDE Breaks It Down series. Today is episode 2, a cold or viral upper respiratory infection. Just in case anybody's wondering, this is what the shirt says. All right, I hope you got a chance to read that. But back to the topic at hand, a cold. A cold is a viral infection of the nasal and upper respiratory area. It generally is not much of concern. However, in some people it can be. And so we always want to make sure that we know kind of what to do about it. Before I even get started, I want to make sure that I ask you guys to like, subscribe, leave comments, engage the channel just to make sure that we get some conversation going. And of course, you can always leave a topic for future discussion if that's what you desire. So let's get back to it about a cold. So a cold is an upper respiratory infection, essentially. Sometimes they are referred to as viral rhinitis or other terms that just simply mean that somebody has an infection of essentially the upper airway, starting from the nose into the back of the throat and mouth and upper trachea type of area. It generally is what we call self-limiting. It lasts for a short period of time and then it goes away. However, in some people it can be prolonged. In some people it can have other complications. Generally, these are younger people, people with some measure of immune naivete or compromise, and other people with other health conditions that could be, complicated by colds, such as asthma. Some people are prone to ear infections. Some people are prone to pneumonias and things like that. But for the vast majority of the population, a cold is a cold. It's an upper respiratory infection that usually lasts something like 1 to 3 days, but it can last up to a week in some people and even up to 2 weeks in some people. Usually though, if a cold lasts for a couple of weeks or longer, it's important to start considering other things. One of the things to consider, of course, would be allergies. Colds and allergies have very similar overlapping symptoms. Runny nose, cough, nasal congestion, stuffy nose. But a fever suggests that it's an infection, which makes it more likely a cold. Whereas with allergies, it just kind of keeps going and going and going until the offending agent is taken away or the histamine has been blocked by an antihistamine, which leads us to treatment of colds. So colds are not something that involves histamine, but allergies are something that involve histamine. So guess which one antihistamines work on? If you think about it just that way, you don't have to worry about taking so much medicine for a cold, right? Because everybody wants their kid to kind of feel better right away if they have a cold, and so we try to give them every medicine under the sun. So one, antihistamines actually don't work on colds. I know sometimes, you'll read somewhere and they'll say give them an antihistamine. It'll dry up the secretions or something like that. But really, an antihistamine is an antihistamine medicine. Histamine is involved in allergies and not in colds. So just by thinking about it that way, it can help you to remember that antihistamines don't work on colds. So what does work on a cold? All right, your immune system works on a cold. I mean, that's it. Time. That doesn't mean you're powerless against a cold, but it does mean that you don't have to worry about trying to feed your child so many different medicines. As a matter of fact, they recently studied it, something like 10 or 12 years ago. where they looked at what happened when a kid was getting cold and cough medicines. It turns out that some of these medicines are combination medicines. They may or may not contain Tylenol. They'll contain a medicine that's claimed to be a something that's gonna dry up the wetness of the cough, or some of them will say it's something that loosens the cough, and they give it to you in different combinations. But they just put some kind of name on it, and parents don't know. And so they give combinations of these medicines, and then the kid ends up in the emergency room because their facial expressions and other parts of their body are acting funny, and they may be even sedated, overly sedated. So we want to make sure that the general population, most people, don't worry too much about a cold, because it's gonna take some time, and you can do some things at home that are non-medicine things that can help a kid in the process of fighting off the cold. The most important things to do, of course, is to keep the kid comfortable. So if they're coughing, it's important to understand that cough itself is a normal reflex. Whenever anything gets into our respiratory tract, anything from the nose all the way down into the lungs, the body wants to send whatever's in there out if it's a foreign material. Viruses are foreign to the body. Air particles, pollen, and various things are foreign to the body. So the body sneezes and coughs to get rid of whatever the offending agent is. So think about it that way. The body does not want this stuff in there, so the body sends it out. So why would you want to suppress a cough, which is clearing the airway? Right? So the key is to understand that there are other things that you can do. So for example, if it's a baby, usually less than 1 year of age, as soon as they become toddlers, they can fight you, they try to run away. So it becomes really hard to kind of suction their nose. So the first thing is we ask that you try to suction their nose. Well, maybe not the first thing, but it's one of many things. So one thing is suctioning their nose. You can use a bulb to suction their nose, or there's this new product, a relatively new product called the Nose Frida, which everybody raves about. You can use that and just try to get some of the boogies out, or a lot of the boogies out. Whatever works for you is fine, as long as you're using it properly. But then if you're not getting much, you might add saline, saltwater nose drops. You can buy that over the counter without the need for prescription. And that should loosen up the mucus as you follow the instructions on the bottle or the box, and see if you can pull out some extra mucus with that. Now, sometimes these companies that make these products can actually have different medicated substances right next to the saline. So it's really important to pay attention to which product you're pulling off the shelf and buying. So they might have, Sudafed, they might have oxymetazoline, strange names. Don't worry about those bizarre names. Saline, saltwater nose drops, that's what you need to kind of use, grab off the shelf and purchase. So saline, suction, and then of course, humidified air. Humidified air makes it easier to breathe. If the air is warm, especially and dry, it can dry up the nasal passages, which might seem to be beneficial, but then what happens is the mucus gets thick and dry in there, and then it breaks off at different times, and then it gets into the airway, and it tickles the back of the throat and makes you cough. So you want humidified air. You want the nose to actually flow. That way, if it's a kid, a toddler who can actually blow their nose, you can get them to blow their nose. You can sit in the bathroom and turn on the shower or something like that if you have that available. And it doesn't have to be hot, it just needs to be humid. So the humidity, the water in the air just contributes to everything else being a little bit more moist, so that you can then suction the nose or get the kid to blow the nose. So humidified air, nasal saline, suction, and if the kid needs it, a little ibuprofen or Tylenol, paracetamol, APAP, or any of the other names that are available around the world. You give that simply to keep the kid more comfortable. That's the crux of it. Now, if you have a kid who goes on to having asthma because they're coughing a lot and it provokes an asthma flare, then you can start their asthma medicine as they're coughing in order to help reduce the cough, which then leads to the flare of the asthma. If anything looks worrisome, if the kid's breathing really hard and heavy. So for example, if a kid looks like they just ran a marathon and you're like, you're not even walking yet, that's probably a good reason to have the kid seen. If fever persists, or if a fever goes away and then comes back, that suggests that there might be what we call a secondary bacterial infection, something like maybe a sinus infection, maybe an ear infection, potentially a pneumonia. So these are all things, of course, that without acting like this video is giving you everything under the sun, making sure that you're thinking about what's going on with your kid that doesn't fit with the general idea. But if it's a cold and the kid's acting well and they're comfortable and you're just doing a little runny nose and wiping it all over you, that's your job as a parent. Take it. However, if they seem to be working hard to breathe, having trouble breathing, wheezing, if they're having other strange noises, especially stridor in young kids, 5 and under usually, with this noise, that's stridor. All right, that suggests that the upper airway is narrowing. It's a good idea to have the kids seen. Usually resting stridor is kind of the cutoff where we decide, okay, this kid could get in trouble. Because if they're already having stridor while they're not working hard to breathe with the type of noise, then that means they should be seen right away. Their airway is inflamed and likely needs something to help reduce some of that inflammation. Potentially a dose of oral steroid or injected steroid or IV steroid. You need to go to an urgent care facility or an ER preferably. But there are some offices that can take care of that. Discuss it with your primary care provider. Always discuss all of this with your provider. This is just meant to be a guide to help everybody to kind of, figure out how to proceed with different conditions. All right, so I described stridor. I'll describe wheezing. Wheezing is this noise which is high-pitched and usually breathing out. All right, so it sounds like, and excuse me, it always makes me cough for some reason whenever I do that. But that noise suggests that the body is trying to force air out of narrowed airways. So that's usually in the smaller airways, deep, deep, deep inside the lungs, where the inside of the airway is inflamed, and so the size of the airway has become much smaller. And now you're trying to force air through a much smaller tube or passageway, which then means that you have to work harder to get the same amount of air, right? Because you only breathe so often, right? In order to maintain that same rate and in order to exchange carbon dioxide and oxygen at the same rate, you kind of need to breathe harder or faster. And if you can't breathe any faster and you're squeezing real hard to try to breathe through narrow tubes, it makes that noise, and that's wheezing. Very often somebody needs what we call a bronchodilator, like albuterol or something like that, in order to open up those airways, and maybe even some anti-inflammatory medicine like an oral steroid in order to help reduce the inflammation inside the airway. But generally, if a kid, is tolerating the cold just fine, but they're active and drinking well and sleeping comfortably, probably not too much more that you need to do. Just watch it for a while, and if it persists and you want someone to just take a look and listen to the kid, of course, bring the kid in to have them seen. However, if they're coughing a lot, if they seem to be working hard to breathe, especially if there's color changes in the face and things like that, that's definitely a reason to have the kid seen. So the important thing is, if a kid looks comfortable, that's a good sign. That doesn't mean you don't have to do anything, but it is a good sign. If they look uncomfortable, you bring them in, as soon as you can. Either bring them to us just to have us take a look at them at the office, or you go to an immediate or urgent care place The ER is for emergencies. And that means that if something seems like an emergency to you, then you're worried enough that they should be seen in the ER. Go. All right. However, I don't want everybody running to the office simply because they have a cold, right? But at the same time, I'm glad to see the kid anytime you want me to. So I think it's a decision you have to make at home. But this is information to help you make that decision. All right. So again, the video's getting long in the tooth because y'all know I like to talk. But let's just wrap it up there. Colds are a viral infection. They can lead to some complications, but most of the time we tolerate them well. There are things that you can do for them, but it does not need cold and cough medicine. Cold and cough medicines aren't even proven to work in kids. So instead, do the supportive care that I mentioned. Nasal saline, suctioning, humidified air, be it from a bathroom shower situation or a cool mist humidifier that you kind of buy over the counter and plug in with water in it to make some water vapor into the air. And then you provide ibuprofen or Tylenol just for comfort, to take the edge off of the discomfort of feeling like you have a cold, and watch the kid and see if they have other things that are going on, such as wheezing, stridor. I described those earlier in the video. Or if they have color changes or if things just don't look right, please go and have the kids seen. All right. So thank you so much. Please like, subscribe, leave a comment, and let me know what you think and what topics we should move on to next. It has been an honor and a pleasure discussing some of these things and trying to get some of this information out there to everybody. I thank you very much. Keep yourself well.